Good afternoon and welcome to the wide environmental impact of healthcare matters to your bottom line webinar. This is the fourth episode of the webinar series which the EcoQuip Plus project organizes explicitly for health managers. EcoQuip Plus is an EU-funded project co-funded from the COSME program of the European Union. The webinar has been organized by the European Health Management Association, EMA. One of our main activities is providing the opportunity for networking and exchange of knowledge on effective health management. Our vision is excellent health management for a healthy Europe. My name is Annette Rosanov and I'm the Policy and Program Director at EMA. I will be the moderator for today. Today's session is dedicated to the environmental impact of the healthcare sector and the role of procurement, and more broadly, the role of the whole supply chain in mitigating climate change and other environmental impacts. After this introduction, we will run a discussion with our two speakers, and then we will open the floor for questions. But before we start the webinar, I would like to introduce some housekeeping rules. The webinar is being recorded, as you heard it when you joined. Please keep your microphones muted during the discussion, and you can copy and paste or type your questions in the question and answer box at any time during the event, and we will take your questions at the end of the webinar. We will also live tweet. So please tag us at the EcoQuip Plus hashtag. And all materials that we produce, recording and summary reports also from the previous 3 webinars and from this one are available on the EcoQuip Plus website. Now let's see whom we will have today, our speakers. First, Arianna Gamba. She's Circular Healthcare Program Manager at Healthcare Without Harm Europe. This program, as its title suggests, is in line with circular economy principles, aiming at minimizing waste and contributing to ethical and sustainable supply chains. Arianna also manages projects and leads on the advocacy activities in this area. Nicole Fletcher is a Sustainable Procurement Lead at NHS England. Nicole leads the operational interventions work stream within the team, focusing on lower carbon products in line with the net zero emission targets. Intervention areas include recycling, walking aids, surgical devices, and personal protective equipment. She has been leading on implementing social value, we will hear about that, and driving innovation in procurement for over 15 years. Both Arianna and Nicole are pleased to share their knowledge and experience with us, which we are particularly grateful for, of course. Before we start the discussion with our two speakers, Arianna and Nicole, first I would like to address a question to the audience. To your knowledge, what are the negative environmental impacts of the healthcare sector? You can put your keywords, it will be a word cloud, so please introduce keywords, to the Mentimeter tool. You can see the QR code or the code in the on the screen, and my colleagues will also share it with you in the chat. So you can click on the link and add the code, and then just add keywords, type keywords what the negative environmental impacts of the healthcare sectors are. Let's wait a couple of more moments and then we can start displaying perhaps the responses. Okay, waste, chemicals, pharmaceuticals, supply chain, poor policy, waste, carbon footprint, single-use plastics, CO2, new ones coming, PFAS, plastics, burning waste. It's quite a wide range, so really coming from policy, I really like that it's also included. Plastics, air pollution, volume, diapers, burning waste, climate change. So plastics came up twice, I see. Waste also, burning and pharma, chemicals. Okay, let's wait for another moment or two to see if anything new comes up. And yeah, then okay, let's start now the discussion with our speakers. So obviously the first question will be the same to you. Arianna, if you would like to kick off, and you can also refer back to the word cloud we saw, don't hesitate.
Thank you, Annette. Thank you much for having me in this webinar. I think it's a very important question to start with, and I'm pleased with the answer we've seen in the Slido or the survey. Normally, when we think of the impacts of the healthcare sector on the environment, we try to categorize them in different sorts of planetary emergency. We have climate change, we have biodiversity, and also environmental or chemical pollution. And when it comes to climate change, according to our estimates, 4.4% of the emissions are coming from the healthcare sector. So if the healthcare sector were a country, would be the 5th largest emitter on the planet. And as many people answer to the survey, we know that more concretely there are other type of pollution like environmental pollution, the chemicals, the pharmaceuticals that end up in the environment, the biodiversity loss and use of resources due to the amounts of products and energy resources that are used by the sector. A few have been mentioned as well as plastics, for instance, is a big one, single-use plastics. So and also according to our estimates, we know that the majority of these emissions, over 70% of these emissions, are coming from the products and services that are used by the sector. And so this is why I think it's important to have this webinar about procurement, because procurement can play a big role in minimizing the environmental impact of the sector. And the healthcare sector has a big role when it comes to procurement, because globally represent almost 10% of the GDP. And in Europe, I think public spending is around 14%, and half of these in the European Union is allocated to healthcare spending. So the healthcare sector has a big role to address its environmental impact through procurement.
Thank you, Arianna, and thanks for already positioning procurement in the impact, the environmental impact, and also the volume. Nicole, would you like to add something to that? And also, please don't hesitate to refer back to the word cloud that our audience has provided.
Sure. So, I mean, I think in the UK we see the same sorts of issues. It's something like about 4% of the UK's emissions are the healthcare sector. but 62% of the healthcare sector's emissions are supply chain. So that's really a big area of focus for us, is to look at the net zero. And I think what's quite interesting is when you look at the other sorts of environmental impacts and the things that came up in that word cloud, so thinking about pollution, plastics, waste, they're either directly interlinked, or there's a clear synergy that if you're working on one, you're bound to start helping address another area. So where we might have a focus on trying to think about how do we reduce carbon emissions, because we know that the healthcare system is going to have to suffer the impacts of climate change, as well as being a major contributor that really needs to get on board to make those changes, is that you see that the opportunities to do that are also around addressing things like single-use plastics, thinking about how do you address waste, how do you look at the freight and the type of fleet that's used will address air pollution. So there is a lot of interlinks in those areas, which is quite helpful in many ways, that we're trying to address. So yeah, there's quite a lot of significant environmental impacts. I think that's the key thing, is that they are significant. So we really do have to sort of step up and try and address them.
Thank you. Well, we are very happy that the topic has been well chosen, the right focus. And if the sector wants to act and react and says, okay, I want to include sustainability as a procurement criterion in the process, how do you do that, Arianna? So how do I start acting against negative impact?
I'm also looking forward to Nicole's answer to this one, as she's.
I will get to that.
But yes, no, I think the first step would be to understand what are the sustainability concerns when these are related to a specific product, whether it's single-use plastics or pharmaceutical, whatever the sector is buying. They need to understand what are the sustainability concerns of the product, its impacts. Looking at the whole life cycle of the impact, not only in my work, I focus a lot on circularity, and so products like single-use plastics are prioritized, but we don't have to look only at the waste. We also have to look at the production, transport, and so on. And so we need to consider, or even the labor conditions of the people who are producing this product. So it's important to try to have this holistic overview of what are the sustainability concerns related to this product, and then to come up with the definition of what this product would look like if it was more sustainable. For instance, when it comes to labor rights, you can ask questions about the number of immigrants you have in the factory to understand if there is a risk. So you need to identify also what are the risks. And once you have this mapping and idea of what are your sustainability demands, it's important to discuss with the sector, with the suppliers, because you need also to understand how they are ready to this type of demands. You don't want to put out a procurement out there that then you don't have companies that are able to meet these demands. So there is work to be done on the supply side as well. And then I think it would be also important, once you introduce the criteria, to have some matrix or a way to evaluate and assess the type of answer you receive from suppliers, so that you can compare and understand what the information they are sending means. And as Without Harm Europe, we prepared some tools that can be used for sustainable procurement criteria. We have templates that could be adapted related, for example, to the procurement of gloves or reusable textiles. And we also developed a sustainable procurement index together with UNDP that can be used with suppliers to assess their sustainability performance. And so there are questions about their the company, the organization, their operations, but also questions about the products. And it has a tiered approach, so the suppliers can advance in their performance with this index.
And are these tools publicly available, Arianna?
Yes, they are publicly available on our website.
Oh, okay. Yeah. Later on, when you have time, perhaps if you want to post them to to the chat so that people can also use them later. And Nicole, you mentioned the NHS supply chain, what big role they play. So how do you do that in the NHS supply chain context?
So in terms of how we incorporate this into tendering exercises, we have a policy that sits across the entire NHS of a minimum 10% weighting applied to social value. Now that is something that applies at every level. So it applies at NHS England, it applies at the hospital trust level. It also applies at NHS supply chain, which is the body that acts as like a procurer and to jointly procure and set up frameworks to be used by the healthcare service. So that's a minimum, and as part of that, because we consider that the climate change is so significant and relevant to everything that we buy and that we do, the requirement is that of the questions that are considered on social value, that climate change is always considered. And then beyond that, we recommend that there's a series of sort of five themes that are looked at, and that depending on what you're purchasing, what's relevant, the scale of it, that you would look to potentially include, say, up to 2 of the additional 4 themes from that. So that's kind of how we take it as an approach across the system. That's been in place for a year or so now, and it's something we're still working on to try and help everybody to get on board, to understand how to do that and to how to get the best out of that situation, how to think about when 10% is appropriate or whether actually it should be more than 10%. So we have training that we are offering and rolling out across the system. We're also looking at things around how do we measure this and help provide support tools that will allow that measurement, I think, both through reporting mechanisms, but also through your managing of your contracts. So that's something that we are looking at, and we are starting to see benefits from that. There's also, we look at other ways to address environmental impacts that goes beyond the evaluation criteria, and that's, I guess, one of the areas that I work on. So all of that sort of circular economy piece in terms of how do we actually get the system to change what they ask for in the first place. So not just differentiating one supplier offer from another through evaluation criteria and trying to get the best offer from a supplier that will do the most in these areas, but also actually changing what it is we're actually asking for in the first place to make sure that that is moving along the lines of a circular approach, whether it's about reuse or remanufacture, or even looking at how can you build in mechanisms that help to reduce waste. So that's sort of the key ways for us. We've also, we're in the process of finalising what we're referring to as buying guides, and this will give guidance across the NHS system to indicate that if you're buying things that are under a specific category of spend, then these are the things that we recommend you should be doing. And that starts to pick up on not just this is what we consider as relevant from a valuation criteria point of view, but also from what you should be specifying and asking for in the first place, and how do you address environmental impacts through that.
Okay, and these buying guides, are they also public, or?
They will not be public, and they're due to be published quite soon. I think that's a sort of, with communications, that's sort of the second stage of us of looking at how can we make these things public. But initially they'll just be available to the NHS system, but I'm sure we can share them with partners. Yeah,
would be useful. And Nicole, you already kind of introduced what I wanted to ask next was, so we got to the point that we want to change, so we included sustainability. We trigger some change in the procurement process, also in a whole organization, I imagine, and then you have to deal with this change. And how do you do that, Nicole?
I mean, I guess that's a challenging one, because what we're trying to do is coming at it from numerous different angles, because so we've got our policy, we've got the headline policy of we want to make these changes, and here's the minimum expectations of how the healthcare service will try and push these things forward through procurement. We've got other things that we try and look to do, as said, around trying to upskill people through training, those sorts of activities, provision of guidance of, when we say we want you to take forward this policy, what does that really look like? What are the examples of how you can do that? And we take a similar approach when we're looking at trying to encourage a rollout of change that is around changes of what we're actually buying. So not just who we're buying it from and what they can offer, but what we're actually buying, of looking for areas where we've got good practice and how we can help to roll that out. And that will start with guidance, but it might go beyond that in terms of looking at things like training or other support tools. And one of the approaches we've done with that is to very much try and get organisations that are keen to sort of pilot these sorts of activities to work on it with us, to identify what is it that you need, whether that's at a procurement level. So is that around working with NHS supply chain on a review of a framework to make sure that what's actually in there is more supportive, and so therefore it's easier for people to buy off the framework and get what they need? Or is it around other support tools that might be around the individuals that need to manage these services or goods, and helping them to understand, get the right people on board locally so that they're signed up to say, yes, we should move to a refurbishment process for our walking aids, not just, wanting to buy something that's lower carbon in its production, but thinking about being more circular and the side that goes from about kind of getting everybody on board and the hearts and minds and like, so that you can get the key stakeholders to say, yes, let's do this, let's make this happen.
Thanks, Nicole. So, Arianna, would you like to add something complementary to policy, upskilling, guidance, scaling up, piloting, and supporting tools? So how do you manage change related to sustainable procurement?
Yeah, I think Nicole provided an exhaustive answer. I would say that from our perspective, the policy, the mandate is essential. So, for example, in the UK, they have this policy now. Not all the European countries are at this stage yet. So I think having a policy for sustainable procurement, mandatory target for green public procurement criteria or social criteria would be important, because it gives a mandate for the people that work in this sector to be able to introduce sustainability criteria and not look only at the price of products. So being able to have this mandate would be essential in terms of what needs to be to change. And I think together with the mandate, you also need a cultural change happening. So what Nicole was mentioning, training and making sure that people are on board with this is essential, because you can have the policy there, but if people do not understand or do not agree with the policy, then the adherence will be very, very low. And so when it comes also to the buy-in, what we saw in the healthcare sector is that the users of the products are essentially the doctor, the nurses. So making sure that when you apply these changes, everybody's on board with the changes is important to make it effective and also long-term. And then also maybe more concretely, when it comes to products, I think probably also needs more business cases, because when it comes to sustainability, often at the when you're buying the product at the purchase, the product might be, if it's more sustainable or reusable, it might be more expensive, but the costs can be recovered in the long term, or maybe not even the long term, medium term. And so you have the policy, but also how to demonstrate to your procurement staff who's managing budget and so on that it's also a cost-effective measure, because in the healthcare sector we have also limited budget sometimes and cannot afford to buy more expensive things. But maybe they're more expensive when you're buying them, but in the then you will see the positive outcomes afterwards. And so I think that having this business case is also important to make sure that the change is sustainable environmentally and financially as well.
So business cases, and you mentioned the measuring, so you can really demonstrate with evidence, right? So it leads us to like you have expected outcomes in your strategy or in your mind at least, but how do you assess and measure the improved outcomes? Who would like to come first? Nicole, yeah.
So, I mean, that sort of ties in neatly with some of the work that I've been leading on with my team in terms of where we're trying to get a change of demand in particular product areas. And as part of that, when we produce guidance, one of the first pages we have on that guidance is the sort of summary business case headlines, because this is kind of what you need to get everybody on board. And nobody kind of comes at this and is able to deliver any of these things in the healthcare system if you don't get the suite of stakeholders on board who all have different things that might be what's the priority for them. So whether that's about the financial implications or the carbon implications or patient safety or other benefits that might result in things like staff well-being. I mean, just this week we were having a meeting with one trust that we're doing a pilot with, looking at rationalisation of surgical instruments on pre-prepared trays for particular types of procedures. And there was, I think, a recognition that even just if you rationalise this down to the what is actually used as opposed to what's historically been placed there, you get carbon benefits from things like reduced sterilisation. There's reduced cost implications there, but there's also quite a bit around staff time and well-being in that those that are doing the pre-operative preparation, you've reduced the number of tasks that they have to do. So there's loads of different benefits that you can do, get through all of these areas. So yeah, I mean, I think it's for us, it's trying to look at the whole range of things. If we're measuring something, we've been trying to work for a while now with some analysts we have in our team around trying to make sure we are using the spend information we have to try and see what's the scale of this and project what might be the cost implications, or what we're finding is a lot of these areas is it's actually cost benefits. You know, there are actually savings in the things that we're working on. But also looking at how to use proxies or other things that are out there, databases that provide information on carbon calculations to help us to come up with that and to try and standardize the approach. And that's something that at the local level, I think has been really helpful, that if we develop centrally carbon calculators, then that gives them a way of measuring that is consistent across the whole system. And so, you know, we're kind of making sure that there's that consistent methodology and building up that expertise centrally. So I think there is a lot that can be done from a, you know, in our sense, from a national perspective, to provide the support locally to give them the knowledge and the information they need, and you know, where they might struggle the capacity to do it themselves.
Yeah, what struck me was interesting that perhaps it's not only the what you use, but how much of it you use as well. So reduction can be an easy measure. Arianna, anything that you would like to add on measuring or assessing the outcomes?
Yeah, I agree with Nicole on looking at the spend data and the procurement data when measuring, definitely. And when it comes to circularity, we produce a toolkit that is called Measuring Reducing Plastics in the Healthcare Sector, and there we help members in looking at their procurement data, but also at the waste. So we run almost 14 plastic waste audits so far in different hospitals across Europe to measure the amounts of plastics that are, and the types of plastic that we can find in the waste. And that is helpful because there are things that from the procurement data you cannot see, perhaps. I don't know, for example, the packaging of the product, or how the people are respecting the segregation of the waste. So there are different tools that can be used to measure the impact and the progress of these initiatives.
Mm-hmm. Arianna, you mentioned end users as well, bringing end users on board. And of course, we talked about the suppliers, so that's the whole supply chain, their role. So how can you convince end users to come on board? And how can you encourage suppliers to do things differently? Nicole, would you like to take it first?
Sure. So, I mean, I guess that's, one of the challenges and one of the things that we absolutely need to work with, and we're trying to very much, I think, by finding pockets of good practice and then rolling out initially what might be relatively straightforward things to replicate. We're using that to gain traction, to show that, look, others in your healthcare system are doing this, and this is how they've gone about it to get them on board. So I think it is very much a trying to inspire the end users to kind of show that there is a different way. There is a real importance of having clinical evidence to demonstrate where perhaps practices that we might think are not particularly good. So things around use of single-use plastics, and demonstrate actually, is there clear evidence that demonstrates from a reuse perspective that this is safe from infection control? So sort of de-risking the kind of the myths or the stigmas or that there might be, and saying these are the areas where there's clear evidence, or there is clear evidence that this or other approach is going to be better, and others can do that. So I think that's been really important for us in identifying who are the key end users that need to be on board with this, and then everybody else will flow behind that and get on board, because they're I guess the ones with the authority in some ways, even if that's not from a government's perspective, but from a system perspective, in terms of those that people look up to. So it might be consultants, for instance. In terms of the supply chain, I think that's where we are seeing that there's a need to start to have conversations with suppliers. And I guess we've been doing this in sort of two different ways. We've got our overarching work that we are doing with the supply chain to make them aware of what we're expecting in terms of the evaluation criteria. There's also another policy approach that will start from next April, where that will be a compliance, in order to be able to bid to be compliant, to bid for work of high value. A carbon reduction plan will be mandatory. So helping them to get that understanding that that's what they need to do at an organizational level. And then we've started to look at how do we bring in things around, if there's a particular product area that we want to change, how do we start to use more kind of engagement with the supply chain and have the conversations with them to say, look, this is where we want to get to. This is the challenge we've got and the scale of it. What we found is that suppliers are interested. Some are slow, but there are plenty out there who are keen to move things along. But what they really need is they also need to hear from the end users. They need to know that the end users want to see this change, and then if the change happens, they will actually get on board with it and then say, let's buy this alternative version or whatever it might be of what we're looking for. So it's trying to engage both the end users and the suppliers to find these new solutions, and say, actually, yes, that kind of solution, that change would work well for us, or it wouldn't. It's really it's improving that dialogue and engagement, and that can be something that we can do both informally, which we are doing to some extent, And it also is something that we might do through a more formal process. So recently we did this on walking aids, where it was a review of the tender or the framework through NHS supply chain, and working jointly with them, we went out to engage the supply chain to say, how do we build refurbishment into this contract? So at the moment, it's set up as a supply of goods only. And there are hospital trusts that do on-site refurbishment. A lot of them don't necessarily have the capacity to do that, but they would like to use refurbished goods. So how do we build the service element into that? And we went through a whole process as part of the kind of pre-tender engagement to identify what that should look like to inform basically what we've ended up putting into the tender requirements that's actually out at the moment. So I'm hoping to see some good results come back from that.
Okay. Arianna, would you like to add something to the end user mapping, good practice replication and formal informal engagement of supply chain?
Sure. Well, I would like to say that when it comes to end user in the healthcare sector, probably the health argument is one of the most compelling ones, because the end users care about the patients and the safety of the patients, the safety of the staff. And so I think when it comes to sustainability, the health, it's not only an environmental issue, but it's also health issues. It's important to underline that, because often the link between environment and health is neglected or given for granted. And also perhaps raise awareness about the health impacts that certain products or operation can have on patients and workers. For instance, there are studies showing Health Without Harm Europe and Health Without Harm Global as well did a lot of work on PVC or toxic chemicals in the sector. And we've seen that there are studies of workers in the neonatal intensive care units, where we have the most vulnerable patients, that are not even aware of the impacts of phthalates and these toxic chemicals that they can have on the patients. And so work needs to be done also in raising awareness amongst the end users about the environmental and health impacts of these products and chemicals use. And then when it comes to the suppliers, I mean, I would agree with Nicole about the dialogue and starting to work with them. I think a lot of our members are already doing that. What AMR, the project EcoKeep, is already doing with the joint statements of demands, I think it's a good way to give a signal to the market, to the suppliers, that there is demand and there is a market for more sustainable products, and ultimately explaining them that this will give them a competitive advantage if they are able to provide alternatives to toxic products or more sustainable solutions. They will be rewarded. So I think it's important to work on both sides, because we've also seen maybe suppliers that do have more sustainable solutions, but the market perhaps is not, the demand for those is not high enough yet. So I think both parties need to do the work.
Then just allow me one question, and then I will stop. I will give floor to the audience. As you mentioned, Arianna, I would like to hook my question to your last sentence. You said the demand is not strong enough. So in principle, the procurement for innovation, the demand side can drive innovation or can come up with new needs, can procurers come up with higher sustainability standards as requirement, and do you have concrete examples for that? Arianna, perhaps, as you said, perhaps you have.
Yeah, I think definitely, because when the sustainability managers and procurers are looking at setting sustainability criteria, you can immediately realize that perhaps the product that you need or that it doesn't exist on the market as sustainable as you want it to be. And so that is where you can identify the innovation gaps or unmet needs, and you can signal that to the market and foster innovation in that sense. And I think we have, for instance, seen an example in Sweden where they were realizing that the gloves were wasted when they were taken out of the box because they were falling on the floor. And so they discussed with their supplier and adapted the packaging in a way that they prevented this waste in the first place. And it might seem like a small change, but they were estimating that 6% of their gloves were wasted just because they were falling on the floor. So it's a big, when you look at the volumes, it can, even a small change like this can have a big impact. Or we have another hospital in Spain that wanted to stop the use of single-use baby bottles, plastics baby bottles, because of the concerns from a waste perspective, but also health, because of the concern of the migration of the chemicals from the plastics to the milk. And the problem they had is that the machine, in principle, to clean and pasteurize these bottles could not support glass, because they wanted to have glass baby bottles. And so again, they discussed it with their suppliers, and ultimately they were able to adapt the machine and make sure that the glass bottles could be, the pasteurization machine could also be used for glass bottles. So this is another example. And I think there are also other examples going beyond plastics about, we have seen one in Poland that also was featured in one of these webinars about wanted to improve the temperature of the room. And so the shadings had voltaic panels. So I think the sector can have a big role in fostering innovation for sustainability.
Thank you, Arianna, for these concrete examples. Nicole, do you have some as well?
So I think the use of standards is really kind of interesting and important. And what we're finding is, having conversations with suppliers is how valuable that is to understand some of the detail. And we can't necessarily do that for every product that's out there, given I know just on our catalogue there's over 500,000 products and there's more than 80,000 suppliers. But certainly we've found in some of the areas it can be quite straightforward in terms of, we might set a standard in terms of what the product needs to adhere to, that might be, say, around recycled quantity of, so the example I'm thinking of is that we've just done some work around trying to shift everybody to using recycled paper. Seems quite straightforward. And then we find that actually there's types of pulp and paper products that sit in the middle, that because of their functionality, trying to increase the recycled content is challenging. But not only that, the amount of available product, the amount of available recyclable material in the market has dramatically changed as we've changed our practices over the years, from less use of paper. So on the one hand, that's a great thing, but it means there's less feedstock to produce something else. So then you start to get into the detail and think, well, okay, if we're talking about the use of, say, sustainable forests, because that might be the alternative feedstock, well, how do we use standards to make sure that we're not just saying we don't feel like we're going backwards, that we are making sure that we're saying there is an alternative here and there is some good measurement and other reasons behind this as to why we might need to consider what we might not have looked at in the past, that we are getting the quality products or materials that rather than just anything. And so that's where standards just become incredibly important. And even when I was mentioning before around standards in terms of how we measure, making sure that we're actually comparing, like for like, in terms of when we say, well, you might have a slightly different product, but how is the carbon measured that's attached to your product versus how is it measured that's attached to somebody else's, and how important that is, just even from a procurement practice point of view, for the potential for challenge, but to make sure that we're actually prioritizing and heading in the right direction. So we're finding more and more, but it's complicated. It's not always just one set of standards is going to be the appropriate one. You might have to think about other areas, because it might be that the product footprint is where you're going to start to see the difference in terms of what's the right direction or not. So yeah, it's a work in progress for us, definitely.
Thanks very much. I would now then take questions from the floor, and I would like to encourage our participants to still post questions. We have one to start with. What are the views of NHS procurement in relation to innovation procurement and working with local SMEs to reduce carbon emissions? So working with local SMEs.
So, I mean, SMEs are definitely an important part of our supply chain, but I guess what we're looking at is probably slightly more of a focus on identifying the hotspots. So, where is it that actually is the carbon attached to? And what we've found is that local doesn't necessarily mean you're focusing on that is going to address what's the biggest part of carbon in a product. Mm-hmm. So you really do need to understand it. In some areas, it's about the material, or it's about the wastage and the single-use nature of the product. So I would say that, you know, it is something we definitely consider, but what we're trying to do when we're thinking about carbon is we're trying to identify for different product areas, where is the carbon actually coming from? Because in some areas, transport is actually really low, and we're not, if we focus on transport alone, then that's not actually going to address the biggest opportunities for reductions. Yes. But it is certainly something we have looked at as well, because there are opportunities there, and certainly, you know, when you think about innovation, that can be where SMEs can be brilliant at coming in and providing opportunities that perhaps larger suppliers aren't. So I think innovation is something we need to look at more, but it is going to be an approach that will probably be around identifying some pockets of priorities to address, rather than, as I said, you know, when you buy so many different products from so many different suppliers, there's not the capacity to do it everywhere. So we've got to be a bit focused about how we do it.
Arianna, would you like to add something to local, working with locals?
Yeah, I think it is an important point that often SMEs do not have access even to big procurement, because when we're talking about procurement in the healthcare sector, the amount of products that are requested, sometimes SMEs are not able to participate to this type of tenders. But I think when it comes to innovation procurement, probably is where they play the biggest role, because they are more agile and are able to innovate and prototype, and are perhaps more open. Maybe something that when it comes to giving this answer in terms of European projects, I think maybe an important aspect would be the language. Because when it comes to local, we've seen it in many countries, using the local language to speak with the market is also important. And so while big companies may have operation in a lot of countries, they can access different markets, when it comes to local, being able to interact with the SMEs also in their language, and provide perhaps also the physical space to meet will be important.
Thank you for the complementary information. And well, bad news is that time was flying so fast that we have come to our session. So I would suggest that we try and conclude from this rich discussion what we have touched upon. I would like to start by the policy or mandate or mandatory target that Arianna mentioned, because that's the kind of starting point you can actually relate to. So you have something that you have a mandate actually that you are acting upon on behalf of that. Taking all aspects into consideration, so production, transport, labor conditions. Also, Nicole said it's not surely the local, which is the lowest emission, because emission can come from somewhere else. So when you assess really the impact, take into consideration a whole range of factors, understand the demand. engage with the suppliers and the demand side, so the system as well. Look for proxies or alternatives, and as Nicole said, sometimes smaller enterprises, SMEs are bigger and more creative in coming up with innovative solutions. And then only including sustainability in the procurement process might not be sufficient, because you need to measure, assess, have evidence of what you reuse and how you reuse, and in order to engage, have business cases, have good practices, and which will inspire people to come with you on the road, on this journey. So this is how I would conclude our discussion. I hope you agree with these key messages that we can let our audience go away. But before you go away, I would like to encourage you to join the EcoQuick Plus Collaborative Buyers Forum to exchange knowledge with other procurement experts. And my colleagues are posting in the chat the link, the LinkedIn group availability. So just click on it and join the forum. And we would also like to recommend you another product, another piece of work which we have produced, a white paper on reducing the environmental impact of medicines. You can download this paper from the EMA website. So this is very much linked to the topic of today. And we will also plan 2 other webinars in 2023. The topics and the dates will be advertised in due course. So with that, I would like to thank Arianna and Nicole for this discussion today. And I wish you a good afternoon, and see you next time. Bye. Bye-bye.
Bye. Thank you for having me.
Bye, thanks.